Call to order the June 26, 2018 meeting of the Saline County Board of Commissioners. I ask that you please silence your cell phones at this time. Will the clerk please call the roll?
Commissioner Shadwick, Commissioner Sparks.
Here.
Commissioner Vidrickson.
Here.
Commissioner Weiss.
Here.
Commissioner White.
Here.
I ask that you please stand, join me in a flag salute, followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We now move to the public forum where citizens may speak on county government, not on today's agenda, usually limited to 3 minutes.
Norman Randall, Saline, Kansas. Is Saline County an equal opportunity employer? My question is, if a position becomes available in some department, is it supposed to be posted or can you just appoint somebody to it? Because everyone should have the opportunity to apply for a position. Thanks.
Thank you. Anyone else wish to speak? Seeing none, I'll bring it back to the Commission for regular business. Item number 1.
Approve agenda for public forum as presented.
Mr. Chairman,
Go ahead.
Mr. Chairman, I move we approve the agenda for the public forum as presented.
Second.
It's been moved and seconded that we approve today's agenda. For all those in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Item number 2.
Approval of county commission minutes for June 19, 2018, which we don't have those. So.
Okay, I'll take a motion to remove that from the agenda then.
So moved.
Second.
Been moved and seconded that we remove item number 2 from today's agenda. All those in favor say aye.
Aye.
Opposed, same sign. Item number 3.
RFA 162-18, MCH home visitor position with Jason Tiller, Health Department Director.
Good morning. How are y'all today?
Morning, Jason.
So you have before you a request for action. We are requesting to increase Megan Deal, the MCH home visitor, from part-time to full-time, which would be 40 hours per week. The Health Department has received grant funding specifically for that purpose within the 2019 grant awards from KDHE, which will completely cover our salary and benefits for the increase in this position. She'll be a full-time county employee working 25 hours a week for the Health Department, 15 hours with the KDHE Perinatal Community Collaborative Program here in Salina. The goal is to increase perinatal education and pregnancy outcomes statewide, including Saline County residents. This action will take effect July 1st, 2018, if approved, with the start of the new state fiscal year, and supervision will continue under her current supervisor, Sherry LaFollette. Alternatives for action: approve the action as is, send the action back for further review, or deny the action. We recommend approving the requested action to move Megan Deal from part-time to full-time due to the reasons I've stated above. Budget impact. As the approved grant amount from KDHE will cover the increase in salary and benefits from part-time to full-time as stated above, there will not be any additional funding from the county required. Full-time is also contingent on grant funding from year to year. You have any questions?
Questions of Mr. Tiller?
No.
Is there any public comment? Seeing none, I'll bring it back to the Commission for possible action.
Mr. Chairman, I move we increase the hours of the MCH, home visitor position contingent upon grant funds as requested by staff.
Second the motion.
It's been moved and seconded that we approve RFA 162-18 for MHC home visitor position. Is there any further discussion? Hearing none, all those in favor say aye. Aye. Opposed, same sign. Motion carries. Move on to item number 4.
KDHE Family Planning Grant Signature with Jason Tiller, Health Department Director.
Good morning again.
Yes, sir.
As we round out the state fiscal year 2018, the Title 10 Family Planning Program has received an additional $6,020 in grant funds to be expended on contraceptives, and we have to expend those funds by June 30th. Staff has the order ready to go. We just need the approval to accept these funds from the chairman, and then we will execute the order and order these additional contraceptives.
I don't seem to have any information on this RFA. Is there some, does everyone else have it?
No. Nope.
Well, I'm not ready to make a motion on something that I can't see.
We didn't have an RFA on this. We've done them in the past in study session, and it was decided that since I was here already for first RFA, just to bring this one to the public forum. And
Well, and that's how I'm trying to get business done, is to do it in the public forum, but I don't really want to act on this myself. I don't want to act on it today. I'd like to take this and read it and have time to think about it for just a second. I don't know what the others feel like, but
Well, it has to be done today, because
Yes,
you
we've
have
gotta
to
get it.
place the
We
order
have
before
to
June 30th.
get this
So
returned to
if we don't do it
KDG
today, then you
and
lose
have
out on the
us-
$6,000 funding.
right.
that's not my fault.
I know.
Can we possibly get copies of that to each of us and bring it to our 3:30 study session? Or,
Yes, I think you could do that. Do you? Can you get the copies upstairs and,
I can, yes.
okay.
That means that we will be undertaking this again in our study session number 2, with the possibility of a vote at that time, which I don't care to do that in the way that we're handling it, but I don't want to lose out on the grant if it seems to be that we need the grant. So, but I do need the time to at least read this and act on it accordingly. Public comment?
Karen Shade Salina. After having attended several years of these meetings, this is how, unfortunately, this works. There's a last-minute call. They're coming to the end of the fiscal year, which is June 30th, and there's some unspent monies elsewhere, and they're giving those who can act and act quickly the opportunity to purchase additional supplies. So I perfectly understand Commissioner Vidrickson's point of view, and I do appreciate that you're trying to do things in public. Unfortunately, this is one of those things where this is how I've seen this occur year after year after year, and it is short notice, but the state only knows probably a few days ahead of this where unspent monies are. There are some counties that choose not to spend money. Maybe they've had a position vacancy, so no one's in that position, so they're going to lose out on the supplies, but the state has a grant with the federal agency that if someone can actually put these supplies to use, they can go ahead and vote on it. So it is unfortunate, but this is how I've seen this interact.
Well, I will state that the letter's dated June the 11th, so that's 2 weeks ago. I don't know if you just received it. I don't see any sign on here to do that. Somebody could call me up and say, if you sign this document today, you get $1 million. I'm not going to sign it. You need to look at the fine print, and that's, as far as representing the county, I feel like I can't just sign off on something that I haven't even given a second thought to. So that's where I'm thinking, and that's where I'm coming from. And anybody else wants to speak or state something different, why, now's your time to speak. Okay, I'll bring it back. Excuse me.
yeah, I will say that if this information can get to us here yet this morning, I think I will have ample time to study it, and maybe some action can take place at our 3:30 session.
I concur, and it seemed to me like it's a one-page document, so it can't be too mind-boggling.
I can make that happen.
Okay, thank you.
All right, this time then we need to have some action on item number 4.
Mr. Chairman, I make a motion that we move item number 4 to the 3:30 study session for possible action.
The 3:30 is not a study session, isn't that an executive session?
Yes, it will be an executive session.
Okay, so we need to move it probably to our second meeting number 2, which follows this meeting, if we're going to act on
do
this.
that, or you could do it, you know, we've got an executive session scheduled in the afternoon, but you could do a study
We
session
can do
prior
an
to
open
that.
session before that? Okay, I'll go along with that, then 3:30 would be fine. Is there a second?
Second.
It's been moved and seconded that we remove item number 4 from this meeting's agenda, place it on the 3:30 meeting of this afternoon. All those in favor say aye.
Aye.
Aye. Opposed, same sign. Item number 5.
RFA 164-18, the Hermes Healthcare Agreement with Rosie Walter, Senior Services Director.
Morning, Rosie.
Good morning. I'm here today to talk to you about this new agreement that I just spoke with this Hermes Healthcare, and they are willing to come into our agency at the Senior Center and provide foot care to all of our seniors. It's billed to their insurance. They take care of everything. So, and if Medicare, their deductible is already met, then it'll be at no cost to our seniors. But this is in addition to our pedicures and manicures. They're going to provide more of a health benefit. They're going to look at diabetic feet, see if they have any abscesses, smooth down toenails, just overall foot health care. So I'm asking for permission today to enter into an agreement with the Hermes Healthcare.
Do you want to go into, tell us about the budget impact, or?
There won't be a budget impact with this. Hermes actually is going to work it all out with all of our patrons. So they will contact Hermes. They'll schedule the appointments. They're just going to use our facility as a place to do it. So all of the appointments will be scheduled with Hermes. All the financials will be scheduled with Hermes. They take care of everything.
Are they going to be charging for this service then to the
Yeah, they will bill it directly to the insurance provider, whoever they use, or Medicare.
So then I'm
and
getting a little bit surprised here then that we're going to allow our facility for someone to conduct business out of, and I'm a little bit concerned about that. I'd like to have more information on that. Rita, do you know anything about this, or?
Well, I think that she's providing a service to the customers that's kind of one-stop shop, and that would be the principle, not that we're providing a place for them to conduct business, but it would be for her customers or her clientele.
It's a huge convenience.
We currently we currently allow manicurists to come in at a nominal fee to do.
Yes.
And that service, I think you said, is booked well in advance.
Yeah, you can't get in for a month, typically 3 weeks to a month, and they charge a very, very minimal $15 fee for a pedicure. That's the beauty end of it.
Right.
We're also going to have, like, Sports Clips is coming in, and they're going to do $5 haircuts, but you can only do this service if you're a senior.
Well, I'm all for senior services, I can tell you that. I am. The other side of it, though, is that I don't know what our obligations are, and liability-wise, those types of things, allowing other outside entities to come in and use our facility to do this. I don't know.
I believe you passed the contract by Mike Montoya, and he
did approve
he
it.
approved it.
Well, it'd be nice to know that.
And in the contract, it does have where they are liable for all of the.
But both of these entities that you're talking about now use electricity or lighting and all this.
Water.
All that. So, and I
Yes.
remember reading in this where they have to have hot water available.
They do.
So,
yeah.
I mean, all of that's available, but at no cost to them, but they're bringing
Insurance.
in, all it is just a service. But,
Right.
wow.
What's the history on Hermes Healthcare? I'm not familiar with them.
Well, I don't know a whole lot about them individually. You know, just in talking to them, they do provide this service for a lot of different facilities. I had a patron come up to me and ask me why we don't do it. So then I just investigated it and found that, you know, it isn't at a cost to our patrons. So I thought, I mean, it's a win-win for us. They do all the scheduling. They do all the insurance billing. We just provide a place.
It appears to be a valuable service.
Very valuable, yes.
Thank you.
What's the What's the time frame on the contract?
I think the July 1st is what we were thinking, is what we put on here
But
for
it
the
can be
contract.
terminated with 30 days' notice.
It can be terminated. I'll have to look at it, yeah.
Okay.
Further questions? We'll entertain public comment.
Karen Shade again. While I agree that these are great services to offer, the one thing that raises my antenna is someone took the initiative to approach Ms. Walters and ask. That doesn't mean that others wouldn't want the same opportunity. So I see this as perhaps an opportunity to do a request for bid or an invitation for proposal and make it wider so that anybody who wanted to had a proposal for providing senior haircuts, or anybody who had a proposal for providing foot care or manicures, pedicures, would have an opportunity to submit a bid or write up a proposal that gets reviewed, and you go with whatever is the most appealing. I think that's what's missing in this conversation.
Well, as a commissioner, I'm certainly not looking to make money off of this. Perhaps we should be, but I don't look at it that way. I'm looking at it a little closer here, and the insurance and indemnity that Hermes has agreed to, and this has been approved by our council. Why it's becoming a little more smooth sailing to me. Although I take Ms. Shade's comments to heart, perhaps you can think about that as these types of things come down the pike, and act accordingly. So, at this time, bring it back to the commission for possible action on RFA 165-18. Whoops, excuse me. This is 164-18. Excuse me.
Mr. Chair, I move we sign the Hermes Health Care Agreement as requested by staff.
Second that.
It's been moved and seconded that we approve RFA 164-18 for the Hermes Healthcare Agreement. Is there any further discussion? All those in favor say aye. Aye. Opposed, same sign. The motion carries. Item number 6.
RFA 165-18, Desktop Computer Replacement Project with Kevin Ellis, Assistant Computer Technology Director.
Good morning, Commissioners.
Morning, Kevin.
This request for action is for the purchase of 39 Dell Optiplex 3060 desktop computers from Dell Government for $23,919.09. This is our annual desktop replacement project request. Each desktop is priced at $613.31, and Saline County budgeted $24,000 for this project in the 2018 TIP. These desktop computers will be deployed in departments throughout Saline County. A second bid from PCM-G priced the same Dell Optiplex 3060 desktop model at $632.48 per unit, or $24,667.11. Alternatives for action are to approve the request as presented or deny the request and send staff back for more research. Staff recommends approving this purchase as requested from Dell Government for the $23,919.09. Dependable hardware on our desktop helps keep the support costs down, and each year we go through our desktop inventory and attempt to replace our oldest machines. The budget impact is that there was a total of $128,542.92 in the 2018 budget for hardware prior to this purchase.
Questions of Mr. Ellis?
Kevin, what happens with the machines that are being replaced?
The last few years, we've actually tried to put them into Purple Wave and sell them off at auction that way.
Before that happens, well, I don't know, has Senior Services, Department of Senior Services, are they now in our pool for replacements on their lab, or would these?
Yes.
Would these, okay.
Further questions? Public comment? Seeing none, I'll bring it back to the commission for possible action on item number 6.
Mr. Chairman, I move we approve the purchase of 39 Dell desktop computers from Dell Government in the amount of $23,919.09.
Second the motion.
It's been moved and seconded that we approve RFA 165-18 for desktop computer replacement project. All those in favor say aye. Aye. Opposed, same sign. Motion carries. We now move to item number 7.
Fireworks safety and weather conditions with Hannah Stambaugh, Emergency Management Director.
Good morning.
Good morning, Hannah.
I don't have anything for you guys to take action on by any means. So this is just a great opportunity, being that tomorrow is when fireworks start going on sale. So perfect opportunity to come in and present with you guys the information as well as the public on Access TV, just so everybody's on the same page and has some information that they can follow. So some important dates and times to remember. Fireworks start going on sale on this Wednesday, June 27th, and they will be sold until July 5th. And then the dates that you can discharge fireworks in the unincorporated areas of the county are the same dates, June 27th to July 5th, and they can be shot off between the hours of 8 a.m. and midnight each day. We do have to remember that there are other incorporated cities within our county that have different rules. Here's a little brief synopsis on those. In the city of Salina, you are only able to discharge fireworks on the 3rd and the 4th from 8 a.m. to 11 p.m. In the city of Gypsum, you're allowed to discharge them July 1st through July 5th. In the city of Smolin, discharge of fireworks is allowed on July 3rd and 4th. And then New Cambria, Area, and Brookville all follow the county's regulations, being able to discharge them June 27th to July 5th. So this is just a good reminder for our citizens to understand where it is that you live, what the rules are, and when the times that you can shoot them off. That is very, very important.
So there are no changes from last year's requirements or ordinances or whatever?
Correct.
Okay, that's thing that everybody's thinking that we're changing things, but we're not.
Nope, we did not change those with our last update of the regulations for fireworks. The rules are consistent throughout all of the communities. You cannot discharge fireworks on public property, meaning you cannot shoot them off on roadways, in parks, road shoulders, any of that. You can discharge them on private property. However, if you do not own that property, you do need to have express written consent from the landowner to do so. You cannot discharge fireworks into, under, or from a car or vehicle. You cannot throw, cast, or propel fireworks in the direction or in the path of any person, group, or group of persons, whether they be on foot, on a bicycle, motorcycle, or in a vehicle. And then you cannot impact adjoining properties from direct contact from the fireworks or residue resulting from the use of fireworks. And then this was one of our last updates with our resolution, was that sky lanterns or the floating lanterns are not allowed in Saline County. Those have been banned.
All right.
So now that we know the rules, just some safety tips that we would like to portray is that never allowing the young children to play or ignite fireworks. Actually, in the city of Salina, it is illegal for minors under the age of 18 to possess them unless they're under the direct supervision of an adult, but that's just in Salina. Always have an adult supervise any type of fireworks activities. Never relight or pick up fireworks that have not been fully ignited. Definitely light fireworks one at a time. Never carry fireworks in a pocket or shoot them from any type of metal or glass container. And always allow for discharged fireworks debris to cool completely and then douse them in a bucket of water or water hose. That's a really good safety tip that we really like to portray to the public. And then just make sure you're cleaning up after yourself as well. One of the biggest things to also remember is that if you are wanting to report any type of fireworks violations, do not call 911. 911 is for emergencies only. This is the administrative number for the Salina Police Department that also dispatches for the Saline County Sheriff and the Salina Police Department, Salina Fire, EMS, and all rural fire. So 826-7210 is the non-emergency number, and that is just to report any type of fireworks violations. Please do not call 911. I would be amiss if I did not mention just weather conditions. I have had several questions prior to the rain that we've received on the dryness of out in the county and just even in the city of Salina too. So just to kind of give you an idea, this is as of June 24th, we have since January 1st received 6.45 inches of rain. Normal amounts are 15.33, so we are still quite a bit behind. With the rain that we did receive the last 2 days, because this data was from the 24th, we are still sitting at probably at least still another 8 inches behind normal precipitation values. So just something to keep in mind. Just a graph to kind of show you where we're at as far as the departure from normal precipitation, and we're kind of we're right next door to the big red blob on there, showing that 8 to 9 inches on average as far as how far we are behind on precipitation. The drought categories, that hasn't changed in the last few weeks, other than in the very southwestern part of the state. And then the predictions for the next following days. This is predictions up until about the 4th of July, showing the higher potential for above normal temperatures and below normal precipitation. I will tell you, though, that the next couple of days we are expecting to have 100-degree temperatures. Saturday and Saturday night, we do have about a 20% chance of rain. Sunday and Sunday night, our chances jump up to about 40%. And then Monday the 2nd is predicted a 30% chance of rain. So hopefully that can kind of stick in there, and if we can still get some little nice showers and everything, I think everything will end up being okay. It's just we really want people to understand that, you know, we are very behind in precipitation. It doesn't seem like it's dry out there because we did just get some rain last night, but just to be careful. So.
All right. Any questions? Thank you for the update. We'll move on to other business or announcements.
Commissioners, I have a invitation. Congressman Roger Marshall is going to be at Senior Services on Friday at 11:30. He wants to talk about our needs, and I wanted to invite you guys to attend. And Rita, if you guys could make it.
All right, thank you. 11:30 on Friday morning at the Senior Services.
Yes.
Congressman Roger Marshall.
Any staff.
All right, thank you very much. At this time, I'd like to announce that we are going to have our second meeting of the day will be following this meeting upstairs in the administrative offices. It is open to the public, and we will take a short break before that time. That meeting will be followed at 3:30 this afternoon by a third meeting for the commission, which will mainly consist of a executive session. So, but we will be acting on this health department request at that time also to start the meeting. So, at this time, I'll entertain a motion for adjournment.
So moved.
Second.
Been moved and seconded that we adjourn this meeting. All those in favor say aye. Aye. Opposed, same sign. We're adjourned.